Hi, I want to speak to you today about the extremely difficult situation facing health and social care in Dumfries and Galloway. I'm sure you'll be aware of the financial challenges facing both the local NHS and the local council. These challenges have prompted necessary actions by both partners affecting NHS health and council social care services alike. Within social care, we're having to be extremely strict on how we award care packages to make sure we provide care to those who need it most. We are also checking to see that where care is in place, it's still needed. This is because the increasing need for social care is far greater than the amount of funding we have available at present. These pressures are also having huge knock-on effects across the system, in the community where nurse teams are having to step in to deliver personal care, work that sits outside their clinical role, simply because that support isn't available elsewhere. So family members and unpaid carers are having to fill gaps where they can, and in our hospitals it massively impacts patient flow and access to treatment. It's backing things up all the way to our emergency departments, meaning people are being treated in the wrong locations or sometimes having to spend nights in corridors. Creating more hospital capacity or asking staff to continue to work out with their normal role is not the answer to this problem. Instead, Dumfries and Galloway Council and NHS Dumfries and Galloway are working hard to make sure there is sufficient social care capacity so that people can go home when they are medically ready. Hospital really isn't the best or safest place to be when you no longer need to be there. This situation is not sustainable and it needs to be addressed. We're working hard to do that, but while we do, there are 3 ways you can help. Firstly, caring for yourself and others. I'm very aware that the vast majority of people and their families are already doing everything they can to support recovery at home or in the community. We see that commitment every day and we're hugely grateful to them and to the thousands of unpaid carers in our region. It's the kind of personal effort and partnership that our system depends on. As we work to improve the situation, we need more people to do the same, to take some responsibility for their own well-being where they can, and where possible, to support family members, friends or neighbours who need help. That doesn't mean people should face things alone. We will always be here to provide support and advice. But we are also seeing a small, though growing, number of people who approach services with unrealistic expectations, seeking outcomes that can't be delivered within the resources we have, or which simply aren't appropriate. Which brings us to number 2, supporting our staff. We understand that people may at times feel frustration during what can be a very difficult time. However, we need to be clear. Abuse of our staff in any form is completely unacceptable. Everyone working in health and social care deserves to feel safe, valued and supported at work, and our teams show professionalism and kindness every day. Abuse, whether verbal or physical, will not be tolerated. So please, support our employees. They are working under enormous pressure and have no direct control over the wider issues affecting the system, and they continue to do everything they can to provide the treatment and care that people need. Third, and finally, be smart with services. Our employees are here to help, but please use health and care services appropriately. Start with pharmacy first for minor conditions. Contact your GP when needed and use NHS Inform or NHS 24 on 111 if you are unsure where to turn. Thank you again for your continued support, your understanding and your kindness towards those working to meet the needs of our communities.